Well, hello, everyone. Hello, 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 and welcome to the first edition of Doctors Are in the House. Today's topic is understanding diabetic ulcers, post op care, and when to seek medical attention. And today's guest is Dr. Obioha. Dr. Chike Obioha is a wound care specialist and an occupational medicine and preventative health doctor. And he'll be with us shortly. But while we are waiting on him, I just want to make sure that all systems are go, that we're able to hear and see everything okay. And there's Dr. Obioha. Dr. Obioha, welcome, welcome, welcome. I'm going to I'm just doing a mic check and make sure that we're on stage and that everybody is able to see and hear us okay. So I'm just going to check my socials to make sure that the audio is working. And in the meantime, I'm going to show a quick video commercial.
Do you have an open, non-healing wound from surgical treatment, bed sore, diabetes, or poor circulation, and you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
All right. Well, Dr. Obioha, welcome. Welcome, welcome, welcome to the show. Can you hear me okay, doctor? I think we have a bit of a delay. Let me see if we can get Dr. Obioha's.
Thank you.
Oh, there you are. Are you able to hear me okay?
Yes,
Wonderful. I think we've got a little lag in the audio. Hopefully that'll clear up here in a second. But let me again introduce you. This is, again, Dr. Chike Obioha, and we're going to be talking about understanding diabetic ulcers today. And so, well, let me expand on that title. We're going to be talking about understanding diabetic ulcers, post-op care, and when to seek medical attention. And so, Dr. Obioha, let's go ahead and get started. Let me ask you first of all to tell me a little bit about yourself. Can you tell us a little bit about your background and what led you to specialize in wound care and occupational medicine? We definitely have a lag. Can you hear me, Doc? Let me check.
so I'm a trained surgeon. I had training that span of.
I think Dr. Obioha is having a little bit of trouble with his internet connection. So if you all can hear me, we'll just go ahead and talk just a little bit while we wait on Dr. Obioha to come back to the stage. Oh, there we are.
training I went.
Doc, I think we lost you for a couple of minutes. So if you want to, can you hear me okay now?
After my training, I went ahead and after my training, I invested some time on wound care, where I spent several years caring for patients who had diabetic foot ulcer mostly, along with all the other wounds that patients present to the clinic with, including post-surgical wounds, patients with amputations and limb loss, patients who have even abdominal surgery and spinal surgery related wounds I had to take care of. Time I opened up a clinic, which is St. Richard's Clinic, trying to harness all the experience and skill set to make sure that these groups of patients are well taken care of, especially in recent times when we have a budget that is now beginning to cut down on healthcare expenses and emphasize them more on people getting back to work to do work. I feel like there can be a better time to support what the budget is providing to the American population than what we're doing in this clinic today.
Okay, wonderful. And Doc, we did miss a little bit of your introduction, but we'll keep going because the meat of the discussion we haven't even gotten to, so we won't belabor the point. But I think there was a bit of a connection problem right there at the beginning, and I think before we post
Yeah.
the video, we can do some editing, so it's fine. So tell me, Dr. Obioha,
Okay.
why is it important to raise awareness about diabetic ulcers and postoperative care, especially in underserved communities?
Yes. So the underserved community, just by the name, shows that they are undermined in terms of resources, and they also be emphasized that they should get awareness to recognize that the resources available to support their well-being is now being compromised by the way the society views it. And as such, they should step up to be more of people guarding their health, and that is what we're here to support them with. So, take for instance, the underserved community is more likely to have systemic illness, metabolic conditions like diabetes. At the same time, they lack the resources to take care of it. So, the aspect of preventive care is to make them aware of how they can prevent themselves from going down the alley road with this problem. And if they do get into that problem, we're there to support them, to get them to come out of it as quickly as possible, get back to work, and be in a position to take, sustain your livelihood. So the whole concept of this clinic is to just kind of cash in on that, support it as much as possible.
Okay. Okay, thank you. And Doc,
I don't know,
again,
did I answer the question right?
I think so. We're still having just a bit of a technical difficulties, but with the recording, it should still be clear despite the technical difficulties that we're having right now. So it's totally fine. We can keep moving. But so Dr. Obioha, tell me why open a clinic? Why
Okay.
did you open your own clinic? What inspired you to do that? Okay, I think we lost the doctor again. Um, we're really having some very serious technical issues tonight with the internet connection. But I will say that we do have a couple of live interviews where we're going to be in the same place at the same time coming up. Dr. Obioha and myself. Um, Coming up in, let's see here, I believe on August 5th is one of those days we will be together. Um, and then we'll also, I think there's another date. We're going to live stream those as well. Um, I believe on the 31st of July will also be in person. We'll be at the Westchester Library, but I will confirm that before the end of our time together today. So, Dr. Obioha, I see that you're back. Can you hear me okay now? Hey, Doc, can you hear me okay? Okay, it appears that he is still having a bit of trouble tuning in. And I think we may have to. Can you hear me okay, Dr. Obioha? Are you able to hear me okay? Okay, I think we're having too many technical glitches tonight. But again, are you there? Can you hear me now?
At least we're still here. The whole idea is this clinic has a lot of resources that joining this. We're also here to guide you through the process of recovery if possible.
And Dr. Obioha, I'm not sure if you have been able to hear me the whole time, but we did lose you for quite a bit of time. I wasn't hearing you on here. Um, so I'd ask you the question about what inspired you to open your own clinic. Okay, I think we're still having issues, and we may just have to try the broadcast again. Nonetheless, we will be in Mason, Ohio, from 7 to 7:30 on August 5th at the library in Mason Public Library, in the Park Hill Room, um, talking about this particular topic. So if you know of anyone in that region in Warren County or Butler County or even in Cincinnati and you want to be in the room to be able to ask Dr. Obioha questions, feel free to do so. We'll also be at Westchester Community Room A and B on Wednesday, July 30th from 6:45 to 7:45 p.m. So July 30th, 6:45 to 7:45 p.m. at the Westchester Midpoint Library. And Dr. Obioha, I can hear you again. Can you hear me okay? Okay, I think the sound, we may have an issue with the internet connection and the sound as well. Um, so, what we will do, because I don't want anyone to miss any of this topic, so I think what we'll do is we'll schedule in person, and then that way we can make sure that everyone's able to hear us. Okay. Is that okay with you, Doc? Yep, I think we still have a connection issue. So I'm going to go ahead and end the stream. And Dr. Obioha, if you can just stick on here for a second.